When I was pregnant with Blake, the pregnancy was completely normal. I was healthy. My daughter was born early, and so we suspected that Blake was going to come a little bit early. But that was it. That was the only thing that we anticipated would be a little bit different about my pregnancy with him. At my 20-week ultrasound, where they check the anatomy and they check the gender, everything was great. Everything looked fantastic. There was no abnormalities. He had all 4 chambers of his heart. At 35 weeks, Blake came into this world as a surprise. It was a lot earlier than we had wanted him to be here, but he was a healthy weight. He was fine. He was okay. Everything was okay to come into the world. Of course, they took him directly to the NICU when he was born, just because he was technically considered a preemie and they wanted to check everything out. They took Blake from me immediately when he was born because he was early and they wanted to check out, make sure everything was okay. And I didn't get to see him for almost 24 hours after he was born because they kept running a lot of tests on him. They wouldn't bring him to my room. They let me go see him in the NICU, but they just wanted to keep a close eye on him. And it wasn't until later that they told me he was breathing a little bit rapidly, which is why they were keeping such a close eye on him. And they wanted to be sure that there wasn't water in his lungs because he was early and because he was delivered via C-section. They thought that it just might be some extra moisture in his lungs, and so they wanted to keep an eye on him. After about 24 hours, I was getting up to go see him in the NICU, and they told me that I couldn't come in because they were running tests on him and they didn't want me in there at the time. Of course, this alarmed me because I didn't know what was happening. But I went back to my room, I took a shower, and it was while I was in the shower that a cardiologist came into my room in the hospital. I could hear him through the shower. I could hear him talking to my husband, and Brian said to him, "Well, you can just tell me what's going on and I'll tell Tiffany." And he said, "No, I'm going to wait until she gets out. Go ahead and call me. Here's my cell number when she gets out." I finally got to talk to the cardiologist, and he told us what was wrong with Blake's heart. We were in absolute and complete shock. There was a little bit of denial because we had the ultrasound that showed all 4 chambers of his heart. I thought something had to be wrong. How could this possibly be? How could you go from having 4 chambers and being developed at 20 weeks to at 35 weeks only having 2 chambers of your heart fully developed? I couldn't comprehend what that meant. And of course, I'm so thankful for the doctors for diagnosing him so soon after he was born, within the first 24 hours of being born. But none of that registered in my head at the time. All I could think about was there has to be a mistake. There has to be a mistake. This can't be my child. Everything was fine. I didn't have anything wrong with me. And they said that they think that sometime after that 20-week ultrasound that he may have suffered a heart attack or something similar in utero, which caused the left side of his heart to stop developing. We don't have a history of congenital heart disease in our family. There were no signs that made us feel like this could even be a possibility. So I think that added to the shock of the situation. And then, of course, I started blaming myself. I started thinking of every day, every minute of my pregnancy, was there something that I did that caused this? Was there something that I did that caused this beautiful, perfect child to be born with half a heart? And, everybody says they don't know what it is. There's no signs that point to any kind of behavior, whether it be exercising or working or whatever I did during that time. There's nothing that points to anybody caused this. It just happened. But at the time, you can't help but blame yourself and wonder why. Why did this happen to this perfect child? I think the hardest part after hearing the diagnosis was hearing what our options were with Blake. The cardiologist told us that we had 3 options. That one, we could put him on a list for a heart transplant, but because he was a newborn, that hearts that size, healthy hearts that size, are very difficult to come by. He told us that we could enjoy our time with Blake, but let Blake pass, and that would happen within probably a week or 2 of his birth. Or we could go through a series of 3 palliative surgeries, meaning that they will never cure his heart, they will never make his heart whole again, but they will extend his life and increase the quality of his life. But that meant that we had to put him through 3 open heart surgeries at a minimum, and that the first one had to happen within his first week of life. So Brian and I are both fighters. We're not the kind of people that just give up, and we certainly weren't going to give up on Blake. That wasn't even an option for us. So we decided that we were going to go through the series of 3 surgeries because we owed it to Blake to let him have the best quality of life that he could have. After that, it was just a kind of crazy, let's look at Brian's insurance, let's look at my insurance, let's figure out which one Blake's going to be on, because we're talking about millions of dollars worth of medical intervention that's happening, and you have to check about lifetime caps, and you have to check about in-network and out-of-network. It was crazy. We also were very lucky that we had family in Houston, and it made our decision to go to Texas Children's Hospital a very easy decision, having one of the best congenital heart programs in the country, because we had access to that medical center and to the amazing and wonderful Dr. Frazier. That was what we wanted to do. And so once we made that decision, everything was focused on getting Blake to Dr. Frazier and to Texas Children's as quickly as possible, and figuring out all of the insurance and logistics to make that happen. At Texas Children's, they are really great because they have an entire medical team that's assigned to you, and especially with these children with single ventricle hearts, they are very delicate and they're very fragile, and so they keep a very close eye on these children. So we met with Dr. Frazier, and we met with the cardiologist that was assigned to us. We met with Dr. Frazier and his team that he had assigned to Blake. It was a very interesting conversation because Blake has a single ventricle heart. There's no question about that. Hypoplastic left heart syndrome means that he only has one side of his heart, the right side, that's functioning. But it also generally means that the aortic arch is also very hypoplastic, which means it's also very small. And his is small, but it's not as small as some kids that have the same condition he has. And they think it's because he had that 20 weeks, at least 20 weeks, where his heart was developing normally. And so his arch developed more normally than, say, a child who had this condition from the moment of conception. So it was interesting because they said his prognosis looks very good, but of course we can't guarantee anything, but this is our success rate, and our success rate comparatively to other hospitals around the country. So it was very reassuring knowing A, that we had made the best decision in terms of care, and then hearing their prognosis for him and how they were more hopeful for him than many children. The other thing that I remember very, very vividly, Dr. Frazier telling me, was that it was going to be harder than this surgery normally is. It's normally a very difficult surgery. The Norwood is the first surgery, and it's very difficult. But because Blake was so small, because he wasn't eating regularly, he was being fed through a feeding tube, he had gotten to under 5 pounds, and so they were very worried about being able to close his chest and to be able to sew him up after surgery. And so that was the only major concern that they had outside of a normal repair of a single ventricle heart. I feel like the situation we went through with Blake forced Brian and I to be stronger. It forced each of our strengths to shine and allowed us to compensate for each other's weaknesses in the situation. He is very pragmatic and very matter-of-fact about the way things have to be approached. I'm very emotional and very, I'm a feeler. And so, I want to be sure that everything is right and everything feels right and that everything's okay with our family. That was the other thing we had to think about. We had a 2-year-old daughter whose life was about to be turned upside down because of this decision that we were making and having no idea what the outcomes would be. So I think it takes both of those types of a feeler and a planner to be able to successfully get through something like this.